Well, welcome everyone. Thanks very much for joining. This is Lois Pace speaking from the Global Health Council. And as you all know, you have joined, or hopefully as you all know, you've all joined a webinar on next week's World Health Organization Executive Board meeting. And we wanted to bring people together to talk about the EB in the event it could help us all with advocacy in advance of that session. We'll get a little bit more into what next week means for each of us, but just by way of background, for those of you who don't know, the Executive Board session is meant to set the agenda for the World Health Assembly, at which GHTC has a pretty substantial delegation every year. And so a lot of us feel that this particular meeting of member states is important when it comes to really driving our collective agenda in the global health community and across our various priorities. So again, that's the purpose of us coming together today. We have invited to join us a number of speakers from various organizations who are tracking issues across the global health agenda, and particularly the agenda that's up for discussion at next week's meeting. First of all, let's get into some logistics for this particular session. In front of you, you will see an agenda of this webinar. And again, I'm starting things off with a welcome and a bit of an overview. But then we'll have remarks from Steve Morrison of CSIS, Matt Robinson from PATH, Katie Dane of the NCD Alliance, and Tina Flores of Rabin Martin. And I want to thank each of them for joining us today and agreeing to speak to each of these topics relevant to next week's meeting. With regards to Q&A, we will do as we usually do for these webinars. We'll allow people to weigh in virtually. Please do use this function. It tends to work well, and it allows many of you to participate, although virtually and although not verbally, in this discussion of sorts. And so we will be looking for your questions to ask each of the presenters after they offer remarks, and then also at the end of all of our remarks. So with that, let's get right in to the discussion for today. So I'll start things off and wanted to offer some background on the meeting from the perspective of a couple of representatives from the U.S. delegation. We were able to have a very helpful conversation with staff from the Department of Health and Human Services just last week, who are already on the ground there in Geneva, and they offered a bit more information with regards to their delegation and the priorities they'll be tracking at next week's meeting. Just so everyone knows, Dr. Tom Frieden of CDC will be leading the delegation, we understand. He has sort of a dual appointment in addition to serving as the head of CDC. He also has a formal appointment to the WHO Executive Board, so he'll be leading the U.S. delegation in that capacity. He'll be joined by senior staff from HHS, Mitch Wolf, who will be stepping in as acting in place of Jimmy Coker, who will be stepping down after this week. And there will be a number of staff joining from other agencies, as we understand, USAID, USTR, NSC, and others, in addition to State Department, which will include Ann Blackwood as a delegate. So some usual suspects for us. Of course, all of this could change potentially in light of the incoming administration. Again, day one of that administration will essentially be the first day of the executive board meeting. So it remains to be seen who from the Trump administration will join, if anyone, but that's the information that they were able to offer right now. Moving on to the issues that they commit to tracking, they were very helpful in walking through the entire agenda with us and outlining where they stand on a number of areas, which many of the presenters will probably touch on. But specifically, they are focused on the DG election as well as WHO reform, and specifically the budget. And so those are top priorities for the U.S. government. I don't want to take away too much from what Steve Morrison will be presenting. I will offer a couple of comments from the staff people to whom we spoke last week to say that they have clarified that they do not offer public endorsement of any DG candidates, and also will not make that information public even once the selection has been made, although they have welcomed feedback from the community with regards to those candidates. And with regards to the budget and the requested increase of assessed contributions, the U.S. does hold firm on its policy of zero nominal growth across U.S. agencies, or excuse me, UN agencies, in the absence of certain criteria being met. And so it's our understanding that they'll be looking for some criteria around transparency, contingency plans, and the like before agreeing to any type of budget increase. And so that's consistent with some of the language they had at the Financing for Development meeting last year, and again, will probably be a matter of some debate at next week's meeting. Our understanding is that that probably won't be resolved, and consensus is unlikely at the executive board meeting, but again, that's a priority that they will be tracking as well. Another issue on which they invited comments is also on FENSA, the Framework for Engagement of Non-State Actors, which you all know GHT has been involved in and leading discussions on for the past couple of years. And so the team at HHS is open to receiving comments from our community with regards to how that has or hasn't worked so far for us. So in addition to any feedback you have on the DG election or the WHO budget and reform agenda, we welcome you to also send comments on FENSA, either directly to HHS if you have those contacts, or you can feel free to send those to GHT, and we will try to ensure that your feedback is reflected in our own next week. That address for people who don't have it is a general mailbox of ours for advocacy. That's advocacy@globalhealth.org. Once again, advocacy@globalhealth.org. With that, I will go ahead and introduce Steve Morrison. If people have questions on what I just presented, there'll be time at the end for questions specific to that update. But because I technically don't speak on behalf of the U.S. government, I hesitate to take questions on any of that at this time, and I do believe some of these issues will be covered in more detail as we make our way through our agenda. So Steve, you're welcome to offer comments or other remarks on the Director General process and WHO reform. Thanks very much.
Thank you very much, Lois, and good afternoon to everyone. Appreciate the opportunity to speak here today. Of the candidates, there are 6, probably familiar to many of you. Tedros Ghebreyesus from Ethiopia, Flavia Bustreo from Italy, Philippe Dutz-Blazy from France, David Nabarro, UK, Sanya Nishtar, Pakistan, and Miklos Shkoshka from Hungary. The EB is going to deliberate on 5 of the 6 and choose 3 names to go forward. The process this time around has changed. It will be a process of secret balloting by the member states at the WHA. So it will be very interesting to see how this all unfolds. I would argue, just in terms of observations about these individuals, they obviously 4 of them are European, and 2 of the 6 are women. There's been lots of commentary around their respective skills. There was an activity in early November, right before our elections, at Chatham House in London, that a short, about 25 or 30-minute video of their 5 of the 6. Tedros had to back out at the last minute, offered good 3-minute synopses of what their vision would be and why they should be selected. I encourage you to watch that. It's entertaining. It's well done. Richard Horton and Suri Moon put that together along with David Heyman at Chatham House. We've hosted here at CSIS, individually we hosted David Nabarro and we hosted Philippe Dutz-Blazy. A couple of general comments. I think that all of them have their respective strengths and accomplishments, and they're all quality people to reach this point. I think in terms of their platforms, there isn't all that much that differentiates them in terms of what they're talking about. They're talking about restoring trust in the institution. They're talking about restoring the financial, rebalancing and restoring the financial capacities of the organization, carrying forward greater and deeper reforms. And then programmatically, they vary to some degree, but it's usually some mixture of, yes, we know we need to be promoting standards and norms. The emergency program, which has been since Ebola, has been the major focus of internal reform. That, I think, by most standards, the emergency program has seen some significant improvements that are underway. And we've seen some other Ebola-related things that have happened, like the vaccine and the launch at Davos of CEPI, but that there's still a sense that this organization suffers from, WHO suffers from some chronic problems of governance, some chronic problems of its financing, and that its trust and confidence has eroded and is quite weak in this period. And so each of these candidates is addressing those realities and trying to make the case that he or she will be able to best carry forward as an agenda that will in a variety of different directions. I think that one important point here is that none of these candidates really qualifies as a statesperson. None of these candidates come forward with considerable gravitas. There is no Gros Brundtland in the mix. Dutz-Blazy, of course, served as foreign minister under Chirac and served as health minister and Minister of Culture. Tedros has served as both health minister and foreign minister. So they do have some high-level diplomatic experience. David Nabarro has served in many capacities at a very senior level at the service of the UN Secretary General. So I don't mean to underestimate the significance of those experiences, but this crop of candidates, none of them really hold out the prospect of somebody coming in who is going to have the kind of gravitas that's been missing in the last several years in terms of being able to lead in a dramatically different fashion. I think that also begs the question of what kind of external alliances will the successful person who takes up duties as the new DG July 1st, what type of backing is this person going to carry among key powers? And that's uncertain, and that in none of their statements, either their written statements or their public statements, have they really enumerated what their political strategy is for getting WHO out of its current set of predicaments. And I think that is one question that I think should be put forward in a significant way, because without the backing of a small nucleus of powerful heads of state, this next person that comes in is going to be struggling against a very formidable array of constraints. And I would add to this that it's important to keep in mind that the general environment right now in Europe and the United States and other parts is one that's not going to look kindly, I think, upon UN agencies. With what's happened in the UK, with Brexit, with what we're seeing as ethno-populist and ethno-nationalist governments coming into power in Washington, D.C., and competing for power in France, in Germany, in Hungary. The next DG is going to come into power inheriting a very an institution that is still in need of significant reform and upgrading and modernization, but money is going to be very tight. Budgets are not likely to grow much in that environment. If anything, they're likely to be under greater stress given these broader political environments. And the ability to operate outside of WHO in building alliances is going to be a critical thing. One last point I'd make is that there is a review of the 7 different studies of what happened post-Ebola. There's a review that is going to be published just prior to the executive board meeting on the 23rd by the British medical journal BMJ. The lead author is Suri Moon, and it looks at the reforms of WHO and what was, and as well as the calls for greater adherence to and compliance with IHR obligations, and some of the key considerations around sharing of knowledge and technology innovation. And it talks about those different, what cuts across those reviews in terms of the call for reforms of WHO and what has actually been implemented. And so I call that to your attention. Some of the folks going out to Geneva will find that very useful. It was rushed to print so that those of you going out will have that available. So that's BMJ. It's going to be published on the 23rd. I'll stop there. Thank you very much.
Thanks very much, Steve. I appreciate that. I don't think we have any questions, so we're going to keep moving on and invite Matt to offer his remarks on R&D and those agenda items.
Yeah, hi everyone. This is Matt Robinson with the Global Health Technologies Coalition. So there are really kind of 2 key agenda items on the formal agenda for research and development at this year's executive board. The first is what is starting to seem like an old friend to many of us, which is the Consultative Expert Working Group on R&D Financing and Coordination, or just the CEWG, as we've all kind of come to call it. And the reason I say it's an old friend at this point is this process, or the predecessor processes that have directly led to this, go back over a decade, and go back, in fact, to the advocacy movement in the early 2000s to create a legally binding treaty or compact that would have assessed contributions of member states the way that WHO does itself, and that this would then fund R&D for the public good. That did not fly with many member states, so after years of negotiation, in 2015, the committee overseeing this at that point approved 5 quote-unquote demonstration projects to show how a multilaterally funded R&D project would work, and presumably to demonstrate that this was a good model for supporting R&D. A 6th was approved slightly later. The problem is precisely the problem that dogged conversations around a mandatory funding treaty, is that because these demonstration projects were all voluntary, they struggled dramatically to raise the necessary resources. So as you can see on the slide, roughly $73 million in shortfall even at this point, even after they've been up and running. The other or I should say another component beyond the demonstration projects, and this is something that actually will be enacted, presuming that the resolution as it currently stands goes through the Executive Board for approval by WHA, and this is the Global Health R&D Observatory. And this is a couple different components that act synergistically. The first is an online database of research activities, whether that's trials or kind of other investigatory activities, and then also an expert committee to help actually drive utilization of that information and help drive the process of gleaning the insights from that database to help then inform global health R&D policy making. To harp on a familiar point, the total projected budget as it currently stands in the resolution is about $6.2 million for 2016-2019. There is a shortfall of 4.3 currently with the funds that have been raised. So it's unclear how much appetite there is among the global health stakeholder community to actually chip in for that, even though this is probably the least controversial component of the CEWG's R&D agenda. Then the final item that is not proposed for approval at this year's WHO governance cycle, but it is put forward for kind of principled input on how WHO should carry forward the development, is the idea of a pooled fund, a voluntary pooled fund that would be hosted at TDR, the Special Program for Tropical Disease Research, targeted to be $100 million a year for 10 years, which would buy 35 to 40 R&D projects of varying complexity, and that by having this be a voluntary pooled fund, access and pricing requirements would be kind of baked into the model itself. I have yet to see any real concrete policy proposals for how this pooled fund would get around some of the fundraising difficulties that have plagued demonstration projects and the observatory, but that's not to say that the WHO Secretariat and TDR might not come back later this year with a novel proposal and a great idea that really does unleash new funding. We just haven't seen what that would be yet. So that's the first kind of bucket of items on the agenda this time around. The second is a new kind of agenda item as opposed to the CEWG that's been around forever on R&D for potentially epidemic diseases. This is a process that is really an offshoot of all of the post-Ebola evaluations and soul searching that Steve referred to and really reflects the understanding that epidemic response or potentially epidemic response can't just be business as usual for research and development. That really WHO needed to get aligned around a single blueprint that would reduce the time to deployment of life-saving and disease-averting medical interventions. So far, this workstream has supported a MERS coronavirus R&D blueprint that has rallied stakeholders around a set of agreed-upon priorities for that. It has produced a R&D landscape analysis of Zika R&D to help inform and guide rapid development of technologies to address gaps in that landscape. And on a slightly longer time scale where it's going to be a little bit longer before we really see some of the results, they're also working to support frameworks that help enable platform technologies, build regulatory capacity, and encourage coordination. And I think these are much more kind of broad convening authority activities that WHO is doing and less concrete than the R&D blueprints, which have very specific technologies and deliverables laid out. And I guess I should have said this at the beginning, but this second agenda item is also an input item. So there's no, so far as I'm aware, kind of concrete action associated with this update. It's more for member states and other stakeholders to be able to provide kind of guidance to WHO as it continues moving this work stream forward. So I will stop there. And Lois, I don't know if we're taking questions now or we're just going to keep rolling, but I'm here.
We might keep rolling. We had one question that wasn't relevant to what you were speaking to, Matt, and so in the absence of other questions, we'll keep going. Again, we invite people to submit questions related to what they've heard already, and then we'll get to those time permitting in the end. But I want to thank you, Matt, for your presentation as well, and move on now to Katie from the NCD Alliance.
Thanks, Lois, and good afternoon, everyone. So in terms of the NCD agenda at the EB, there's a few different sub-items up for discussion. The first one is around preparations for the 2018 UN high-level meeting on NCDs. This one has a number of different elements. So the main focus of the paper is to talk about progress so far in the lead up to the 2018 high-level meeting. That's going to be the next big opportunity for advocacy around NCDs. It will be the third UN high-level meeting that we've had. So the paper on the UN high-level meeting talks about the progress so far against some of the 4 time-bound national commitments on NCDs. It's rather depressing reading. So for example, it says that in 2015, 138 member states have shown very poor or no progress, and not much has changed since, which is fairly depressing reading. In terms of the 2018 high-level meeting, what it's actually asking the EB to do is provide guidance on the process. So the EB and WHO this year is really when we're going to start seeing the contours of the process leading up to the 2018 high-level meeting. And the key things that we know so far, which are highlighted in this paper, is that it will really kick off in October, when WHO will issue their global progress report on NCDs, which will then go to the UN General Assembly for discussion. And then what WHO is proposing in this EB paper is that we will have regional intergovernmental meetings between October 2017 and May 2018, which in our view and the NCD Alliance's view is a really good thing, because what we didn't see in 2014, which was the last high-level meeting, there was a real lack of focus at the regional level with no regional meetings in the lead up to 2014. So this is a good thing from our perspective. Also in this paper on 2018 high-level meeting, there are a number of updates on different assignments that WHO has had related to NCDs. One of them is an update of Appendix 3 of the Global NCD Action Plan, a rather technical and horrible term for a document, which is actually fairly important, because what it is a summary of the cost-effective priority interventions for NCD prevention and control. And from our own experience, what we're really seeing is that governments are using Appendix 3 as the basis for planning the NCD response at the country level. So there have been a number of changes to Appendix 3. What they agreed when this appendix was adopted a few years ago was that they would essentially review it every few years to make sure that it was reflecting the most up-to-date evidence on cost effectiveness. So what they've essentially done is it now includes 86 interventions rather than 62. And the biggest changes that you can see in that document are interventions against treatment and prevention. So I'd recommend people to take a look at that if you have a chance, because, as I say, it is really being used as the foundations for planning on NCD prevention and control at the country level. A couple of other things in that paper are an update on where WHO has got to in what they've called a register of contributions of non-state actors. Again, a fairly bit of a mouthful. What essentially this is the idea is that non-state actors, i.e. NGOs, private sector, foundations, can be voluntarily registering their commitments on NCD prevention and control to WHO. and it would involve a self-reporting tool for non-state actors and an internet platform on which we all could be uploading our commitments, and then there would be a regular monitoring and reporting of those commitments. Obviously the idea is to get non-state actors fully involved in NCDs. However, this is always a bit challenging considering the FENSA agreement. A couple of other things in that paper are that it includes the new work plan for the global coordination mechanism for NCDs, which is for 2018 to 2019, and it also mentions that there will be two important evaluations. There will be an evaluation on the global NCD action plan, end of 2016, as in last year, to the middle of 2017, and that will feed into the 2018 high-level meeting. And then secondly, an evaluation of the GCM, which is going to be happening more like May 2017 through to the end of the year. And that will really be looking at, is the GCM fit for purpose, has it been delivering on its strategic objectives, etc. So in a nutshell, in terms of the 2018 agenda item, what the EB will be asked for in terms of the resolution is to endorse the updated Appendix 3, i.e. the cost-effective interventions. It will be invited to note the GCM's work plan for 2018 to 2019, and they will also request the WHO Director General to submit a report on preparations for the 2018 high-level meeting. But informally, what it's also asking member states at the EB is to provide guidance on how they see the process in the lead up to 2018, which in our view, in the NCD Alliance's view, is the most important part. And so what we have done in support of that is actually developed some advocacy messages and priorities around what we want to see in terms of the process in the lead up to 2018, and they're available on our website. So in terms of other agenda items under NCDs, there is also the Global Action Plan on the Public Health Response to Dementia. Just a few quick words on that. This is the first time that we've ever had a Global Action Plan on dementia. What has happened in the past is that dementia has often kind of slipped through the gaps of NCDs, the NMH cluster, and mental health, and so it hasn't really had a kind of solid footing in WHO. And so what this Global Action Plan really presents is an opportunity for a strategic plan with objectives, targets and indicators to be measuring progress against. And obviously what the NCD Alliance and Alzheimer's Disease International will be really pushing for is to make sure that that plan is also costed, because as we all know, as Steve was mentioning, finances are always challenging within WHO. Another agenda item under NCDs is the report of the Commission on Ending Childhood Obesity, the implementation plan. So what this is that obviously the Ending Childhood Obesity Commission took place last year. They came out with their report, and then they were basically tasked with developing an implementation plan for the Commission's recommendations. This has gone under consultation throughout of 2016, and so now what they are requesting the member states of the EB to do is to provide further guidance on the plan. And overall, we're very happy with the plan. It's really comprehensive, but what we are asking them to do is to consider the development of a framework for monitoring of the actual concrete actions included in the ECHO plan. Then the final one I just wanted to mention briefly, which again is important for NCDs, it's the final sub-item of NCDs, is cancer prevention and control in the context of an integrated approach. And what we've got here is a proposed cancer resolution. And why is this important for NCDs more broadly? It's important for a few reasons. Firstly, what the resolution seeks to do, and sorry, I should have highlighted that the last cancer resolution was in 2005, so a very long time ago, and it was only very, very high level, didn't really include that much detail in terms of cancer prevention and control. So that's the first reason why it's important, because it's been a long time since cancer specifically has been on the EB's agenda. Secondly, it's important because it really strengthens the integration of cancer within NCDs, within the broader health agenda, and also within sustainable development, because obviously this is post the SDGs being adopted and cancer and NCDs being included for the first time. It also, importantly from our perspective, gives WHO the mandate to extend technical support to member states for prevention and control of cancer. and it also encourages and underpins the importance of cancer plan implementation and access to quality treatment, which again is an important part of the cancer response. What we see lacking in the cancer resolution at the moment is we would like to see much more of a focus on mobilization of financial resources for cancer, and also specifically calling out increased development funding for cancer. Obviously, as you'll all be aware, development funding for NCD as a whole is a fairly bleak picture still. So we're looking to use this cancer resolution as an opportunity to really kind of push that message again. And we'd also like to see a bit of a stronger link with maternal, newborn child and adolescent health and HIV/AIDS services and primary health care. So really trying to push the integration message for cancer and NCDs more broadly as well. So that's the cancer resolution. So those are the four main ones. In addition, there is an agenda item on the public health dimension of the world drug problem, but the NCD Alliance isn't particularly focused on that one. So I just wanted to focus on those four. Thanks, Lois.
Thanks, Katie. We appreciate that. Not seeing questions for Katie, we will move on to Tina. We did receive a couple of questions regarding Steve's presentation, and so for those of you who did ask that and have additional questions, we'll be answering those following Tina's remarks. But Tina from Rabin Martin.
Great. Thanks, Lois, and thank you, everyone, for the opportunity to present to you today. So as Matt and Steve alluded to, this executive board meeting will have a heavy focus on health security, and under the agenda item 7, which focuses on preparedness, surveillance, and response, the EB is going to discuss issues around the WHO's response in large-scale public health emergencies. As Matt discussed, this includes progress to advance R&D for emerging health threats so that the response time between the declaration of the public health emergency and the time the vaccines, diagnostics, and medicines are rolled out is shortened, so you have a better chance of kind of controlling the spread. With this is a discussion on how the WHO can improve coordination of the health workforce during emergencies at the global, regional, and country levels, and how better harmonization across those levels are going to happen. There will also be a discussion on the issue of Zika, particularly as there is a revised Zika strategic response plan, which has been in effect since July 2016 and will continue to be in place until the end of 2017. Also, and Steve provided more detail on this, is that last year, as part of the WHO reform process, the Independent Oversight and Advisory Committee for the WHO Health Emergency Program was established, and they'll provide an overview of the current status of the program, including updates on the progress of implementing that program, including staffing, activities, etc. And then there will be an update on the implementation of the Antimicrobial Resistance Global Action Plan, as well as the development of a global framework for AMR. There will also be a discussion on the implementation plan of the international health regulations, which will be submitted for discussion to the full World Health Assembly in May. And finally, there will be a review and proposed revisions to the pandemic flu framework. But the discussions around global health security will actually happen on the weekend prior to the additional discussions on global health security at the country level will begin the weekend prior to the opening of the EB. So on Saturday, January 21st, the Global Health Security Agenda Steering Group, which is the 10 countries really driving the GHSA, will be meeting for the day at WHO headquarters. The chair of the GHSA this year is the Republic of Korea, and to date there are 55 countries that are part of the GHSA. This year's chair has also extended an invitation to 3 non-government entities to do presentations on what they're doing around GHSA, and those are the GHSA Coalition, which is a multi-sectoral coalition working to advance health security, Next Generation, which is younger folks who are working on health security, and the GHSA Private Sector Roundtable, which is a coalition of companies working to advance health security globally. And then on Sunday, January 22nd, the Alliance for Country Assessments for Global Health Security and IHR Implementation, also known as the Alliance, it's a very long name, will also have a day-long meeting. And the Alliance supports WHO and governments in the Joint External Evaluations, the JEEs. To date, there are 53 members, including governments and international organizations. And again, the chair of the Alliance, which is Finland, extended an invitation to, I believe, the GHSA Coalition and the Private Sector Roundtable to do presentations on what they're doing and how they would like to better engage with countries at a local level. So I'm going to stop there.
Thank you, Tina. Appreciate those remarks. We don't have any questions, I believe, on GHSA or emergency preparedness. So let's circle back to the couple of questions we had for Steve Morrison. Regarding the Director General selection in particular, Steve, I think you have this in front of you as well, but it sounds like WHO has come under fire for being a little bit too comfortable in its report and guidance with regards to development and not doing more at a country level with health system strengthening and capacity building. So what are the candidates saying specifically with regards to their vision and how they can do more at a country level around health systems and capacity building? Have any of the candidates been more vocal about certain plans or approaches on these fronts? And have certain candidates been kind of more forthright about those plans than others? Can you comment on that question first?
Sure. Well, I think that all of them in some form or another give a nod to providing. Are you still there?
Yes, we are here.
Yeah. Acknowledge the need for continued or enhanced interest in building up basic health capacities, and it takes the language. The language may differ slightly, but I think they all see that as fundamental to any kind of campaign to get elected. That's a requisite campaign position, and exactly what that would mean with what resources and with what additional operational capacity would they require. I think for for many of the partner countries, certainly low-income countries, this is a very, very important position to be taken. I would think that operationally, Tedros probably has the highest credibility in this regard, given the innovations that he introduced as Minister of Health. I think that Dutz Blasi has greater credibility in terms of innovative financing, creating Unitaid. Flavia Bustreo on launching the Alliance on Maternal and Newborn Child Health has standing there. I'm less familiar with Sonia Nishtar's brief tenure as health minister in a period when it was moving towards a much more provincial-based system, and I'm not very familiar with the Hungarian candidate. David Nabarro is committed on this. He's smart. He understands where this fits. Thank you.
Thanks, Steve. And one more related question, or I think somewhat related question, is around to what extent the candidates propose, I guess, strengthening the Geneva office and headquarters compared to the regional offices, especially considering political trends and budget constraints with regard to major donor countries. What do you think their focus will be, or how have they talked about that focus moving forward?
This is one of my frustrations with these candidates. I mean, the fact that Geneva is starved for cash, that 80% of its budget is voluntary and designated targeted money versus assessed. None of them have really come forward with a very credible proposal for how they plan on correcting that, and what kind of compact, what kind of bargain would be needed politically, what kind of internal reforms would be required in order to convince donors, the very small subset of donors who account for the overwhelming share of the funding, to up their commitments. What would be the reforms? Dutz Blasi is pretty explicit in his program in saying that there needs to be a much tighter alignment of responsibility between Geneva and the 6 regional entities. Exactly what that means, I don't know. I think this is the tensions between Geneva and the regionals are very real, and whoever it is who comes in as the next DG has very limited sway over the composition and the electoral processes of those regional heads, and has to be fairly careful. This is one of those, chronic governing constraints that the Director General faces, which gets back to my bigger point, which is that it's going to take a very determined and highly skilled leader in order to get WHO out of its current predicaments. And I don't see much evidence of these folks bringing much of that. I think Nabarro has the greatest and most in-depth operational experience. I would think he would likely be a one-term, just like Dutz Blasi, he would likely be a one-term DG. The others are younger and more likely to be two-term. That's one consideration to think about in terms of how risk-averse, how much are they going to enter this office determined to get reelected in another 4 years for a second 5-year term, and be exceedingly cautious in that period, versus going into this thinking that they're going to make a major run at some of the deep problems that WHO faces and build the political capital in order to carry these things out and take the hits they're going to take.
Right. That's very helpful, Steve. Thank you, and quite insightful. I actually have one final question before we close this out, which is in light of those characteristics that you mentioned being a priority as part of this process, where do you, or how do you see member states aligning? Are you hearing any rumors about either preferred candidates or preferred characteristics that the member states themselves have voiced? And I'm thinking about kind of the dichotomy of the various folks on the slate, so whether that's kind of an internal or external candidate, whether it's people with a background in health or development. You know, as you said, there are other ways to slice up the group, but do you feel the tide getting behind one or the other?
Well, first of all, I think you need to ask to what degree are their home countries rallying behind them. I think Tedros has had a pretty serious campaign. The Rwandans and others have put together some funding, and so he got off to a pretty aggressive start. But then the state of emergency and the problems, the crises at home, I think has been a dominant and understandable preoccupation, and it's also damaged Ethiopia's position internationally, and it's limited Tedros's ability to get out there. He was able, as you all know, he was able to get the Africa Union member states to vote in support of him. There's been debate around how significant and how representative is that truly of sentiment on his behalf. So I think he stands a reasonably good shot. I think he has some support and credibility both within Africa but also in Europe and in North America. He's well known, he's well understood. Flavia Bustreo, I don't believe the Italians have made much of an investment in support of her. I may be wrong. I think that becomes very important factor in opening doors and beginning to count votes, because the vote processes are complicated and weighted, and that sort of vote counting and shaking of the tree by your partner, by your host government, your home government, becomes very important. The French have been quite aggressive and made a major play. I find that quite interesting, given that Dutz-Blazy does not hail from the Hollande side of the equation. Hollande's government is in pretty precipitous decline, and they're heading towards an election fairly soon. So one question is, what's the durability and follow-through on the French side? I think they've been quite aggressive and supportive and serious in this effort. Nabarro, David Nabarro, the British candidate, I think that David's been, my sense is that he's been to some degree on his own in this process, in this period. He's gotten some support. He also is more advantaged in the fact that he's really on the circuit itself in the work that he already does, and that makes things easier. I think all of these, one thing to keep in mind is that the race will really kick into high gear after the executive board has chosen the 3 candidates, and then the race will begin from the end of January through to the World Health Assembly vote in May. So we haven't entered the full campaign period. And to some degree, some of these home governments are holding back to see, where things land. The Hungarian candidate seems to be among the weakest. The Hungarian government really doesn't contribute much to the WHO budget and has indicated it has no intention of improving that. Sonia Nishtar from Pakistan, she's had some level of activism with some support, and I think she has done well, has come across as quite impressive in her public presentations and in her one-on-ones. She's also taken positions that have been more provocative and a little bit more edgy, which I find refreshing, but that may carry a price in other quarters. Thank you.
Thank you, Steve. Well, I want to thank each of the presenters for providing remarks and insights with regards to discussions next week. I hope that our members found the information useful. With the last couple of minutes we have here today, I wanted to remind you all that we will have a small Global Health Council delegation attending the Executive Board session, and so we'll be sure to keep you all posted as we engage in some of those discussions on site. You can follow us on social media for some of those updates. We've also asked delegates to consider authoring blogs that we could post either during or following the meeting so that you all can be kept apprised of everything happening real time. And then we also are planning a debrief following the Executive Board meeting, which we generally do after these types of engagements. So stay tuned for that. In addition, we'll be gearing up for World Health Assembly fairly soon, and so you'll hear more from us about our engagement with WHO later this quarter. And as a reminder, we will be inviting registration to join our GHT delegation, and this is obviously specific to members and a benefit for current members in 2017. But we welcome all current members to join our delegation for the World Health Assembly in May, given that it sounds like we'll have a fairly robust agenda. So with that, thank you again to everyone for joining our webinar. We appreciate your time today, and we wish everyone well.
Many thanks, Lois, for pulling this together. Great work. Really grateful to you.
Thank you very much, Steve. And thank you again to Tina, Matt, and Katie who joined us as well. We appreciate all of our presenters and all of you who joined.
Thanks, everyone. Appreciate the opportunity. Travel safely. Bye.